But we will begin with health care. It's the #1 priority for Canadians. Canada's federal and provincial health ministers will meet tomorrow in Halifax to begin their discussions on the next health care accord. The current agreement expires in 2014, and in tough economic times, these negotiations will likely focus on better results for the roughly $40 billion a year in cash and tax points the federal government ships to the provinces. And the provinces spend even more on health, often by cutting funds to other programs. And that amount is slated to rise 6% a year for the next 4 years, that amount coming from the federal government. So what should a new health care accord look like? Can we afford to simply put more and more money into the system? And what should the federal government demand by way of conditions and benchmarks for the money it gives the provinces to deliver health care? Well, let's bring in members of the Commons Health Committee for their thoughts and their expectations of these discussions. Well, Colin Carey is the Parliamentary Secretary to the Minister of Health. Libby Davies is the health critic for the official opposition NDP, and Hedy Fry is the health critic for the Liberal Party. Good to see you all.
Hi, Peter.
Colin Carey, let me start with you. The government has a big deficit to deal with. We all know that. We've heard the concerns from Canadians who want a better bang for their buck from health care spending. Your government has promised to maintain the funding increases for health care at 6% a year right through 2016, but will Ottawa be telling the provinces that after that there will be much smaller increases in federal funding?
Well, as you know, Peter, the current agreement, there's 2.5 years before this current agreement ends. The minister is getting a proactive approach. This is a preliminary meeting she's going to be having with them this week. She's very excited about it. We have some new ministers coming with all the elections that we had during the fall. So they're going to have a great opportunity, not only, I guess, to talk somewhat of the funding, but they're going to be talking about the different innovations that have been going on, the different partnerships. And she's going to be asking the provinces how we can help them out, because healthcare services, as you know, is a provincial, the delivery of services is a provincial jurisdiction. So we're going to be asking them, what are they seeing on the ground? What are they seeing that, what innovations are working, what things aren't working, and where we have to go in the future. So it's going to be an exciting meeting. They're going to be talking about things like the obesity initiative, things that wellness and prevention, things that haven't been talked about before. So this is going to be a first good meeting, and first of many, I guess, to see where we're going to be going into the future. Yeah, because Canadians want accountability and they want transparency. They want to know that their government is spending their money wisely.
Well, all governments. Libby Davies, what position should the federal government be taking as these negotiations begin with the provinces on a new health care accord?
Well, first of all, Peter, I think that it's very likely that we'll see the Conservative government trying to lower expectations about what's going to happen, because really the performance has been quite appalling since the last accord. The 2004 accord actually had very few strings attached. They did make commitments on things like long-term care, on a drug plan, and there's no question. I mean, all of the witnesses that we're hearing at our health committee right now are all saying the same thing about what we need to do in terms of better coverage on these issues. And so, on the one hand, there's the issue that the existing accord that we haven't that the federal government has not met the commitments that were made in 2004. And then, of course, that leads us into 2014. And there will be, I think, a growing pressure and expectation that we have to make our medical system work better. We have to have better coverage under Medicare. And that there are critical issues, if we're to move away from the high costs of acute care, that we have to have things like better drug coverage. We need to have long-term care, home care. And unless the federal government shows the leadership to really get this happening, both in terms of the 2004 accord, which, as Colin has pointed out, we still have 2 years plus to go on, then we're not going to make any progress. And so I think it's quite a critical issue right now.
Okay, Hedy Fry, you were part of the government that negotiated the current health care accord with those yearly funding increases running at, well, about twice the rate of inflation. We all remember that meeting of First Ministers in 2004 to get a deal, and fairly urgently. As a physician, has the current health care accord delivered the results you wanted and you expected?
No. And it hasn't, and in every report that came out from every group, that examined the accord, that looked at it in terms of reporting, said that the failure of the accord was not funding. The failure of the accord was a lack of federal government leadership to participate in some of the things that the accord asked for. I think it's interesting that the government continues to talk about provincial jurisdiction and delivering of services. What people forget, and what the federal government conveniently forgets, is that the 2004 accord was about transformative change. It allowed the federal government and the provincial governments to become flexible in terms of those old jurisdictional silos and to come together on things like health, human resources, to come together on things like pharmacare, on things like home care and community care, where money was put into doing pilot projects on those.
Okay, well,
the federal government hasn't done any of that, and it's kind of sad because I think what the expectations of this meeting tomorrow is really very low. When the federal government hasn't come to the table since 2006, it has not met with any of the first ministers, and every single organization is asking for the Prime Minister to meet with first ministers.
Okay. Let's Colin Carey.
Can I correct the record a little bit too, because you were around. You remember that what they called the health accord was nothing more than a blank check. What we're doing is taking a proactive approach. Mr. Martin brought all these ministers into a room on a weekend, the last minute, and forced them by the end of the weekend to come up with an agreement, and basically he walked away with his tail between his legs and offered them a blank check with no accountability, no bars to being set, and this is the accord that we're stuck with right now.
Okay,
so our government's going to be taking
This is revisionist history.
Okay, do the thing that Canadians are wanting us to do, Peter, and this is the reality.
Okay, well, hang on.
So we can't confuse apples and oranges.
No, we can't. But I mean, I don't want. I mean, we're talking about a little bit about this accord, but we're talking about the next one.
Well, mostly. All the more reason that in 2014 we do have to make sure that the accord, whatever is agreed to, has real accountability and strings attached. Absolutely. It's not just about a transfer of money.
Okay, so wait, hang on.
You brought a good point about money,
folks. Let's have the CPAC accord here. We'll just move along. Everybody will have time here. Don't worry.
Okay, good.
Mr. Carey, back to you. Your government, are you looking at a health care accord where the federal government places strict conditions on the money that it transfers to the provinces for health, or are you more likely to say to individual provinces, you set your priorities based on your own needs, here's the money, spend it the way you believe is best for your province, and could that mean a new accord with more privatization of healthcare?
Well, first of all, I'm not going to presuppose what's going to be happening after these discussions. As I said this week, what we're doing, there's 2.5 years left in the current accord that we were left, that was negotiated by the Liberals. We're following through with that, with the low accountability.
Yeah, no, but what I'm getting at here is your government's been very clear about health being a provincial jurisdiction.
Absolutely.
And so what I'm saying is, are you more likely to be talking about the kinds of things that Libby Davies is talking about and Hedy Fry is talking about, of sort of pan-Canadian programs, or are you going more likely to say, look, this is a provincial jurisdiction, the provinces will use the money the way they see fit?
Well, it's going to be a combination of the two of them. And like I said, we're not going to be presupposing what the outcomes are going to be. But as my colleague said, Canadians want accountability. They want to know how their money is going to be spent. So tomorrow and the next day, the minister is going to be actually talking to the province, listening, which is a little bit different than locking people up in a room and saying by the end of the weekend we have to come out with some type of agreement. So we're going to be working. We're going to be working with the provinces because it's a partnership. And this is what Canadians are asking of their government. They're asking of the minister to take a leadership role, to listen to the provinces. They know their jurisdictions. They know how to best work it. They want to find out between each other what are the best practices. Okay. And we have been learning at committee. We're doing chronic diseases and aging right now. Yep. There is a shifting demographic, and it's going to be about innovation in new ways. It's not just about throwing more money at it.
Libby Davies, even though the federal government contributes almost $40 billion each year in health transfers to the provinces and tax points, when Medicare began 45 years ago, the feds paid half the cost. Now that's down to less than a quarter. So does the federal government still have the moral authority to tell provinces how to run healthcare.
Oh, absolutely. I mean, the Canada Health Act is a very important act, and it lays out the 5 principles of Medicare. And I think what we've seen happen is that because the federal government has abandoned its role, not just with this government but previous governments as well, that we've actually lost a time and follow through on our Canada Health Act. And so we do have an opportunity in 2014 to actually make some real progress. But it's not just about the money. It is about accountability, and I was glad to hear the health minister say that. But it's got to be about committing to pan-Canadian programs. I mean, you can't have this sort of, well, maybe you get drug coverage here but you don't there, maybe you get home care here but you don't there. I mean, Canadians want to know that these things are universal and accessible and affordable, and that's what they've got to hammer out.
Okay,
and they can do it. Yes. I think they can do it in a way that will actually save money. If we had a drug plan dealing with generics and bulk buying, we would be saving probably $10 billion a year.
Okay,
Peter.
Hedy Fry, what's your view on what role the federal government should be playing versus saying to the provinces, here it is, you know best what you need in your province?
Saying to the provinces, here it is, you know best, we give you the money, do your own thing, is going right back to what we've had in the last way that healthcare was delivered. When the First Ministers met in 2004, they all decided, so the revisionist history that Mr. Carey just put forward is absolute nonsense. We were the government, we knew what was on the table. We had a moral authority, and we said that things couldn't happen the same way it used to. We've got to change the system in a real way. We've got to stop having these silos. And the reason that we talked about those 3 big pieces where the federal government has not been accountable, this federal government has not been accountable in meeting those objectives, is health, human resources, farmer care, and home and community care, which will give us, allow me to finish please, I didn't cut through anybody.
Go ahead.
We need to be able to talk about how we will change the system. Those 3 pieces were going to give transformative change in the system. This federal government has not kept its part of the bargain. So if we want to talk about accountability, they're the ones who handed a blank check and have not kept the bargain.
Okay,
what you should know, one quick thing, Peter,
very quickly,
that, okay, and it's quick, the farmer care was going to be funded by BC Minister of Health and the federal government. Did you know that they have not met since 2006 when this government came in? That's lack of accountability by the federal government.
I want to finish on the funding issue because we hear from a lot of quarters that the current rate of funding, even though the Conservative government is committed to it to 2016, is not sustainable. Most provinces are talking about increasing healthcare spending by 3% or less next year. So, Mr. Carey, why should the federal government be bound to increases of 6%, and will it be after 2016?
Well, Peter, we've made our commitments, and we're going to stick with the commitments.
What about after 2016?
Remember, as I said, I'm not going to presuppose what the arrangement is going to be with the provinces, but what we're not going to do, remember the provinces were very upset because the Liberals cut $25 billion out of transfers to the provinces. We're not going to do that. We're going to treat them with respect, and despite what my colleagues say, there are jurisdictional issues here. There are responsibilities. It's called the Canada Health Act. They know what they're supposed to do. We're supposed to be doing what we're going to be doing.
Okay,
we're going to engage them early. We're not going to be throwing them into a room at the very last minute and say, listen, we have to come up with some type of agreement.
Yeah,
as we know, signing a blank check is not what this is about.
Okay,
this is about innovation and doing things differently, working with best practices.
We've covered some of that, so I'm just dealing specifically with the money issue here now. Libby Davies, do you think the federal government has to commit to 6% a year beyond 2016 when the provinces aren't committing nearly that kind of increases on their own?
Well, I do think we have to have a commitment for long-term sustainable funding, but it's got to be done in partnership with real commitments, not just a wish list and not just like, oh, well, ambiguous statements. It's actually got to be things that can be delivered and that the federal government is willing to work on and that the provinces are willing to work on. And I do think that was a flaw in 2004. We have a chance to learn from what's happened, and in 2014 to say if the money's here and if it's going to go beyond 2016, it's got to be on the basis that some fundamental changes are taking place and that some of these critical services that Canadians need, and everyone's saying, the high cost of acute care, we've got to change the system. So we have an opportunity opportunity to do that. But it can't just be vague, sort of, like we think this is a good idea. It's actually got to be delivered through an agreement.
Let me hear a final comment from you, Hedy Fry, on the money issue.
Okay,
is it sustainable at 6% a year?
Well, first and foremost, that was something that this government decided to add 2 more years of 6%. The point is that if you're not going to meet your commitments for the 2004 Accord, which the federal government hasn't done, you cannot create the sustainability and the transformative change. One of the most important things is that if we were looking at home care and community care, moving out of an expensive hospital-based system and an expensive physician-only based system, we could find savings in that system to be able to look at things like mental health without putting any new money in other than the amount promised. It is about getting the transformative change going, which will create cost effectiveness and patient outcomes, which are part of accountability. Accountability is not about dollars. It's about quality of care, it's about timeliness of care, it's about patient outcomes. Those were all written in the 2004 Accord, and I would ask Mr. Curry to actually read it.
Okay, well, he's not going to get a chance to answer your plea, but listen, thank you all. This is a debate that I know we'll have again, because there's a horizon here that's out a little bit before there is another Accord, but the conversation, I think, really begins in the country in the next couple of days, so thanks for your time tonight.
Thank you, Peter.
Thank you.